this video, what we're going to talk about is SystmConnect. Now, SystmConnect has taken over from eConsult as a way to externally put in requests to the practice, and there are loads of options. So in this video, I'm just going to give you a quick overview for it. So if you go over to our website, www.eaglescliffemedical.co.uk, and you'll see that fairly high up on the page, you'll get to this bit, okay? And you'll see here SystmConnect. So click on this. This will take you to a separate page. You'll see here SystmConnect powered by System One. This is the name of the electronic healthcare record program that stores all of your digital data. You know you're on the right one because it's got it here, okay, and it's got our practice there. Now, you'll see here it says Continuous System Online. Now, that was the original portal that you could do to access part of your notes, etc., or with the NHS app. You don't have to do this, okay? So just clarify that first. You really don't have to do this, but it will save you a bit of time at the end, and I'll show you what I mean, okay? So we're going to do a couple of videos, take a deeper dive into these areas, okay? But just having a look, you've got quite a few options here. So for example, let's say we do a non-medical issue. We've got a new clinical problem routine. And what I mean by this is that if you want an appointment of some sort, whether that be with one of our nurses, doctors, advanced care practitioners, but you know that you don't need to be seen either that day, okay? You just want to book in advance. What we do is obviously we're not expecting you to be medically trained, but there are some certain severe things that we worry about, okay? And also just to make sure that you've got none of those, okay? So please note this is for requesting you routine appointments, so I agree, and that gives you options in terms of what you want to do. Do you want a face-to-face non-urgent routine, so within the week, telephone routine appointment within the next 2 to 3 weeks, and then so we've got sort of a couple of options really. So pick what you want. Do you want telephone or face-to-face? Do you want it within the next 2 to 3 weeks or the next week? So let's go with I want a face-to-face non-urgent appointment for the next 2 weeks. Now tell us what's brought you here today. This is really important, and on the receiving end, as having seen patients with having filled this out, this is where the joy brings, because the more information you give out, I appreciate we've got limited time from our end, but actually the more you put in there, the more we can sort of get further forward, okay? So let's put here, I've had a continuous cough now for 5 weeks. Please put more detail on that. I'm only doing it for this video. Have you spoken to a clinician about this before? No, it's a new condition. How long have you had these symptoms? Over a month. Have you tried anything? Yes. So over the counter medicine. Smoking status. Say I'm a moderate smoker. It's going to pop up if you want the smoking services, and also different numbers that you can phone. Marvelous. Appointment booking links. Okay. So what this is that you've got a couple of options. You don't have to do this. But the idea is that we've got certain appointments set aside that if you want to, we can send you a link within the time frame specified, and then we'll give you a text back and you can book in that appointment directly. So you say, yes, please, I want a booking link, okay? Now, if you have logged in via SystmConnect or the NHS, you'll log in that way. This will automatically be populated, okay? So you've got your, forename, surname, date of birth, whether, what your gender, and also your NHS number if you know it, and your preferred communication method, okay? So postcode, we can then fill it in there, and then we hit submit request. Now, you may think, well, actually, this is really useful, but whoever I want to do it for can't possibly do it. That's absolutely fine. So are you the patient, a healthcare professional, or someone else? So if, say, like, you've had a district nurse or another doctor come out to see you, and you're like, right, actually, I think they need to be seen, you can put it as healthcare professional. Or what is commonly used, say, if you want to do this for a child or someone who is, not sort of supportive of, or someone who really would struggle with this, you can put it as someone else. You put your information, and then there should be an element for the patient information there as well. Okay, so what we can do is we can just double check that actually you should be helping them out and should having access to them, and then the patient information there as well. Okay, what happens as soon as that is submitted, that gets viewed by our team. We'll just sanity check it, make sure we're not missing anything, and then you'll be offered the link from that way. Normally, it's a really quick service, and more importantly, saves you from phoning up. So go and check it out. We can do a couple more in-depth videos on how to use SystmConnect really well.